Hello YouTube and welcome to southern Thailand on what's quite a wet and miserable day. The full-blown rainy season doesn't start until the beginning of October and then goes through to the end of the year. And September is a bit of a variable month. We can have some really nice weather, but it's all interspersed with days like this which are quite wet and miserable. And I've been looking at my statistics on the channel and it seems that the most popular thing I do are these walk around videos, and I'm a bit surprised because with the channel I was hoping to add some value by using my 18 years of experience of living in Thailand, and those videos don't really need that experience. Anyone with a camera can do those, so I didn't think they added much value, but people seem to like them, and so I will do what people want. And I was hoping to do one last weekend. It's quite difficult to do from Monday to Friday, and the weekends are the only opportunity I get. And on last Friday, my wife's employer told her that she had to go into the school on Saturday and Sunday, and I had to stay at home and look after the kids. Anyway, hopefully this weekend will be better, and I might have an opportunity to get out again. Let's just start off with a quick COVID update. And there were some new regulations that came into force on the 1st of September and will continue through to the 14th of September, then they'll change again. So at the moment, there's still a curfew. I wasn't sure, but there's a curfew from 9 p.m. until 4 a.m. And at the moment, some businesses are allowed to reopen, but they've got to observe all the regulations, the social distancing, proper ventilation, all employees are supposed to be vaccinated, that sort of thing. Restaurants, we can now actually go to a restaurant and sit down and eat, which we haven't been able to do for a while, but there are regulations. With indoors restaurants with air conditioning, the restaurant can only be full to 50% capacity. If a restaurant has an area outside without air conditioning, that can be full to 75% capacity. Shopping malls are allowed to open again with the exception of cinemas, so that should put some life back into places like Central Festival. And inter-provincial travel is allowed again, but again the buses can only be full to 75% capacity and all passengers have to wear masks. I've just had to pay for my health insurance premium this year for myself and my family. It's the 17th year I've had to do this, and in the video I'm going to tell you exactly how much I've had to pay for each of those 17 years. But I also thought it might be useful just to give you a sort of high-level overview of the Thai healthcare system. When I first got to Thailand, I found it was very different to the UK system where I came from, and it took me a while to get used to. And this information might be useful if you're intending doing a long stay in Thailand. Now, your first reaction to health and healthcare is that it's not relevant to you. You're never ill and you haven't seen a doctor for 20 years, and that's not going to change if you go to Thailand. But there are certain things to consider. And the first is road accidents. Thailand has the second most dangerous roads in the world. And even if you're not driving yourself, there's a good chance that you could be involved in a traffic accident. There are mosquitoes everywhere. It's very difficult to avoid being bitten, and some mosquitoes can carry some very nasty diseases. There are also a lot of venomous snakes. I don't see too many, I haven't been bitten myself, but people do get bitten, and some of the venom from certain species of snake can be deadly. Where I am in southern Thailand, there is no cool season. There is constant heat and humidity throughout the year, and that heat and humidity can put a real strain on your body and make you susceptible to a lot of diseases. If you're a Western man that likes to play around with Thai females, there are lots of nasty sexually transmitted diseases, and there's a prevalence of diseases that just aren't major problems in the West, but they are in Thailand. Food hygiene isn't always the best, and I've had several bouts of food poisoning in the last 18 years. And a friend of a friend actually died from food poisoning in Thailand. He was American. He got food poisoning in Thailand and tried to get home and didn't make it. He died before he got back. So even if you're really healthy in the West, that may not be the case if you go to live in Thailand. And on the question of health insurance, it may be a case where you need health insurance to get a certain visa type. At the moment, I get a marriage visa and I don't need to have health insurance, but there's nothing to say that that won't change in the future. This is a quite fascinating book. It's all about views of Thailand as seen from people who lived there during the early part of the 20th century, from around 1900 to 1910. There's a big section on healthcare, and it basically says that certain people with certain medical conditions shouldn't go to Thailand, and even healthy people should only go at certain times of the year, and they should be extremely careful about how they take care of their health. Like most countries, Thailand has public and private hospitals, but it's a lot more nuanced than just saying it's a two-tier system. Because of the huge wealth inequality in Thailand, there are facilities for billionaires and there are facilities for paupers, and there's a lot in between. Some of the private hospitals are very plush, but some of the public hospitals have better facilities. When I had an eye infection several years ago, I went to a doctor at a private hospital, but he needed to do lab tests to establish what kind of infection it was. It was actually a fungal infection, and the lab he used was in a public hospital. When my son was born with pneumonia in a private hospital, he had to go into a neonatal intensive care unit, and the best one in southern Thailand is in a local public hospital. Therefore, private hospitals aren't necessarily better than public hospitals, they're just different. There's nothing to stop foreigners using public hospitals, but that's not what they're really intended for. They're intended for the poor masses. And if you go alone without a Thai person and you don't speak or read Thai, you're going to have really big problems. I also heard that public hospitals were going to raise fees for foreigners to discourage them from going to public hospitals. Foreigners are intended to go to private hospitals, and these places employ English-speaking meet and greet staff just to make the process very easy for foreigners. The top ones, such as the Bamrong Rat Hospital in Bangkok and the Bangkok hospital chain, are very expensive. My personal preference is to go to more affordable private hospitals. There's no general practitioner system like there is in the UK. So regardless of the problem you have, you can go to a public or private hospital. I thought that was quite strange when I got to Thailand, because in the UK I only ever went to hospitals for accident or emergency or for scheduled operations. But you also have some other options in Thailand. Because wages are so low, many doctors open their own private clinics, so you can see exactly the same doctor as you would see in a hospital, but for a lot cheaper. If it's not a major problem, the pharmacies in Thailand are also very good. Pharmacists do a 6-year degree, the same as doctors in Thailand, and although they can't do sort of hands-on diagnosis, if you explain the problem to them, they can often help you. The first thing you need to decide about health insurance is what level of cover you want. And from experience, I found that level 2 here is good enough for the more affordable private hospitals, but it won't be enough if you want to go to the top hospitals like Bamrong Rat and the Bangkok hospital. I've also found from experience that when myself or one of my family needs to be admitted, it's always a 2-night stay, and once again the plan 2 is sufficient to cover a 2-night stay. Of course, it's up to you, and if you want to save money you can opt for level 1, or if you want to go to a plusher hospital you can opt for levels 3 or 4. My first choice is the Rat Yindi in Hat Yai. It's not quite as plush as the Bangkok hospital, but my insurance covers the cost. If I go to the Bangkok hospital, the insurance doesn't cover the cost and I end up paying some of the bill myself. And here are the details of what I've paid for health insurance over the last 17 years. And from 2005 to 2011, it was just for me as a single man, and that was OPD and IPD. I'll talk about OPD in a minute. Our daughter was born in 2011 and I added her to the policy in 2012. And kids from when they're newborn up until the age of about 5 are quite high risk, so the premium tends to be quite high. But then it drops because after 5 they're at a much lower risk. In 2013 I added my wife, so then I was paying for 3 people, and all of these figures are for IPD and OPD. In 2014 I decided to drop OPD because it just wasn't worth it. It was costing me about 8,000 baht a year, and there was a maximum claim each time of 1,000 baht. So for it to be worthwhile, I had to go to OPD 8 times a year or more, and that just never happens. With OPD, I might go once or twice, or maybe not at all, but certainly not 8 times. The other reason for dropping OPD in 2014 was that my son was born that year, so then I was paying for 4 people and it was starting to get quite expensive. And in 2015 there was a 15% increase, and in 2016 the premium remained the same. In 2017 there was quite a big increase, and in 2018 there was an even bigger increase, and I wasn't very happy about this because it was costing me almost 55,000 baht. So I started to call around other insurance companies, and I was actually quite shocked. And it wasn't until I spoke to other insurance companies that I realised what a good deal I was getting from AXA. I'd been an AXA customer since 2005, so as a long-term customer they were giving me quite good discounts. And when I went to other companies as a new customer, I was getting quotes of like over 200,000 baht, 250,000 baht or something. So once I'd heard a few of these quotes, I very quickly returned to AXA and said, yeah, sure, 55,000 baht is fine. Premiums depend on age, and in 2020 my son went from the 0 to 5 to the 6 to 10 band. And as I just said, when children get older, they're less of a risk, so their premiums actually go down. So I saw a decrease in 2020. But then in 2021 it went back up because I've just moved into a new age band. I should add that these figures are what I pay personally, and they're not what you should expect to pay. Your premium will depend on your age, your medical history and other factors. I'm an existing long-term customer with my health insurance company, but if you're a new customer you will expect to pay more for your policy. Also, if you take out a new policy, there will be an exclusion period. I think it's around 6 months where you're not allowed to make any claims. I hope that you found at least some of that useful. If you have any comments, questions or other feedback, please leave them below, and more videos soon. Thank you for watching.